Hi, my name is Kylie Grabenstein. I did my evidence-based project on reducing the risk of cardiovascular disease. Cardiovascular disease is such a big deal in America right now because 610,000 people die each year of heart disease. That averages at 1 in every 4 deaths. That's 90%, or 90% of that could have been prevented. And since there's such strong evidence showing that exercise can reduce the risk of cardiovascular disease, it could be beneficial to prescribe an exercise routine for the patients that are at risk. The patients at risk are patients with high cholesterol levels over 200, high blood pressure 140 over 9, more than 140 over 90, considered overweight with a BMI of more than 25, and have a sedentary lifestyle. These people will be the target audience that are guided for this study. For this study, I used for this plan, I used 4 different studies, which are level 2 randomized control trials, primary studies, and they're considered reliable. Each study uses quantitative data. Study 1 had an EduCoer plan, and it showed in that plan, which was teaching and monitoring an exercise program. Patients in that plan reduced their cardiovascular risk from 16% to 13.3% in 12 weeks by making lifestyle modifications. These lifestyle modifications were just diet and physical activity. This shows that exercise and good nutrition could be beneficial to decrease cardiovascular risk. In the second study, a 5% weight loss was shown to improve lipid profile and reduce inflammation in obese individuals. That study showed that nutrition and exercise are important to decrease weight loss. In study 3, it determined between high-intensity training and low-intensity training. Both high-intensity and low-intensity aerobic exercises were effective in reducing cardiovascular risk in obese individuals. In study 4, some of the cardiovascular risk factors saw positive changes with walking programs like 10,000 steps per day after 10 weeks in the study. And it kind of showed that programs such as 10,000 steps can provide alternatives for an aerobic exercise that are not as intimidating to those who have not previously exercised. Each of the studies have strong evidence and consistent results. The results of each study lean towards exercise and reducing the risk of cardiovascular disease. Providing an exercise prescription of 10,000 steps per day for at least 4 or 5 days a week should be feasible for patients, and it should be appropriate for most people with risk of cardiovascular disease because it is a pretty moderate aerobic exercise rather than running at a 70% heart rate on a treadmill or something. Also, as shown in study 4, a walking program may be less intimidating for somebody that isn't used to vigorous exercise programs. For recruitment, primary care providers will seek out patients who have the risk of cardiovascular disease, which I went over already, but they were high cholesterol levels, high blood pressure, considered overweight, and admit to a sedentary lifestyle. After they find these patients, informed consent will be done. The informed consent will inform the patients of the risk and benefits of the study. It will also inform the patients of exactly what the study will consist of and allow them to have any time to answer any questions. Before the study, there will be an in-service for the primary care providers instructing them on the exercise prescriptions that they'll be giving to their patients. They will also give them a handout from American Heart Association with the recommendations for the cardiovascular health. The chart will be flagged for each patient that they give it to so that they can follow up with the patient. Before they give the patient the prescription, they will get their blood pressure, cholesterol levels, and waist circumference, and then the patient will follow up again in 4 weeks, they'll follow up again in 8 weeks, and then they'll follow up again in 12 weeks. Finally, the results will be measured at the end of the study which will be 1 year, and they'll be compared with their baseline to see how the exercise program helps with their cardiovascular risk. The plan will begin in January 2019, and it'll end in January 2020. After that, the outcomes will be evaluated by the patient's blood pressures, cholesterol levels, and waist circumference. Patient in the non-treatment group and the treatment group will be compared based off of their initial levels, and then they'll be compared off the levels 4 weeks, 8 weeks, 12 weeks, and the very end of the study. Outcomes will be reported to the primary care providers, and then the outcomes will be reported to the patients so that they know how the study helped. And then the next step of the plan will be to educate people about the results, basically teach people if exercising can reduce the risk of cardiovascular disease, teach people the exercises that they should be doing. If the results showed that 10,000 steps per day can reduce the risk of cardiovascular disease, then physicians and nurse practitioners will be educated that it could, and hopefully they will start handing out prescriptions to their patients saying this is how much you need to exercise to reduce your risk of cardiovascular disease. In addition, there will be posters hung up in physician offices. There'll be in services. People will go around teaching patients about exercise and simple exercise programs such as 10,000 steps per day, even just 3 days a week, rather than a sedentary lifestyle. I believe that this is a really important topic because, like I said, 90% of the heart disease deaths are preventable. So being able to prevent them with just a simple exercise program like this would be a great step towards preventing cardiovascular disease in general. So hopefully we're able to, in the future, teach our patients about the risk and the benefits of exercising. Thank you.